My name is Wayne Anthony Lee. The title of my practice is Hill Country Orthopedic Surgery and Sports Medicine. My educational training started at Xavier University in New Orleans. From there, I went to Meharry Medical College in Nashville, Tennessee. I chose orthopedic surgery because I like fixing things. As a kid, I always liked putting things together and taking them apart. But I also was a Boy Scout and I worked with people and did community service with that and with church. So ortho was a good way to put things together by fixing people who have broken bones, but also helping people get back to the way they were before. I moved to San Antonio because I had an opportunity with a multi-specialty group, and then after that I went out on my own and started my practice, which I'm in presently. I serve patients from high school to the mature patients, which I call them, which are the geriatric patients. I do general orthopedics, but primarily I focus on sports medicine, as well as trauma management, geriatric trauma, as well as total joints. My practice is unique in that it is a boutique practice. My staff and myself, we spend a tremendous amount of time making sure the patients feel comfortable, making sure they get excellent care, making sure that all their needs are taken care of, and making sure that they have a finished product in terms of the orthopedic problem that they present into the office with. Advances in orthopedic surgery treatment within the past 10 years have been enormous. There have been advances in terms of anesthesia. We now do regional anesthesia and such that we can take a patient for a total joint replacement and they can go home the same day. We have advances in terms of regenerative orthopedics, where we can take your blood or your bone marrow and use it to help in terms of regenerative cells or in decreasing the amount of trauma to tissue. And last but not least, we've done advances in terms of limb salvage, where we can take patients who had severe diabetic foot injuries or severe trauma and prevent them from having amputations, which there are a lot of in this country. I am involved with the Texas Orthopedic Association, the Association of Ringside Physicians, and I'm also involved with the Association of Sports Medicine. I am presently the chairman of the advisory committee for the Texas Combative Sports Commission, and basically what my role is on the committee is to work with other physicians, promoters, and lay persons to look at the overall care and management of the boxer. The best part of what I do is getting people back to the quality of life that they had prior to their injury. I see patients who have musculoskeletal injuries, so they don't necessarily have to have surgery. Sometimes they just need medical management, they need physical therapy. If you want to learn more about my practice, visit my website or call my office.